Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome to this week's episode of the Healing Pain Podcast. I am your host, Dr. Joe Tatta. As always, it's a pleasure to be spending this time with you. On this week's episode, we're talking about the latest in pain science and pain education with our expert guest, Dr. Carey Rothschild. Carey is an assistant professor in the Department of Physical Therapy at the University of Central Florida. In addition to earning her DPT degree, she is also board certified in orthopedic physical therapy and in sports physical therapy, and earned a certificate of achievement in pelvic physical therapy. Her research related to running and the female athlete has been published in the Strength and Conditioning Journal, the Journal of Strength and Conditioning Research, Sports Health, and the Journal of Women's Health Physical Therapy. In 2019, Carey received the award for excellence in academic teaching from the Florida Physical Therapy Association. And a big part of that was for her innovation in developing and teaching one of the nation's first pain mechanisms and treatment in rehabilitation courses for both physical therapists as well as other healthcare professionals. On today's episode, we'll discuss the foundational and important aspects of pain science and pain education, the steps Dr. Rothschild took to create a brand new course on pain science education at the university level, and how she has expanded the delivery of pain education not only for physical therapy students, but also for other healthcare professionals such as social workers. And before we begin, I wanted to let you know that Dr. Rothschild has joined the Integrative Pain Science Institute as faculty and educator. And as part of her joining, she has two offerings that I wanted to share with you today. The first one is a free masterclass on pain science education. So if you like what you hear today, stick around for next week, or if you're on our mailing list, be on the lookout for an email with regard to a pain science education masterclass. It's a 40-minute masterclass where Dr. Rothschild reviews a case study on a 45-year-old female with chronic pelvic and lower back pain. This is appropriate for both physical medicine professionals as well as mental health professionals. And then on Sunday, June 6th, keep an eye out for a unique course offering that Carey is delivering through the Integrative Pain Science Institute. It is called Pain Education for the Healthcare Professional. This is a 6-week, 7-hour CEU activity where you'll learn the latest in pain science as well as pain education and how to effectively assess and treat the multidimensional nature of pain. Again, that's a 6-week course. It's worth 7 CEs/CEUs. It's called Pain Education for the Healthcare Professional. Of course, make sure you're on the mailing list. So go over to the integrativePainScienceInstitute.com and hop on our mailing list. You can opt in anywhere to receive our emails, and you'll receive updates both on the Pain Science Education Masterclass, as well as the Pain Education for Healthcare Professional CEU course and activity. Okay, without further ado, let's begin and let's meet Dr. Carey Rothschild. Hey there, Carey. Welcome to the podcast. It's great to have you here.
Hi, Joe. Thanks for having me.
You reached out to me a couple of months ago about pain neuroscience education and just pain science in general. And you said, hey, I'm teaching a course on this and I'd love to come on and share what I've learned and some of the experience with your listeners, which we're excited to hear about all the work that you're doing. As I mentioned, you're a professor at a physical therapy program, a DPT program in Florida, in Orlando. Tell us how you first became interested in pain science, and just give us an idea how long you've been teaching for and when did pain science come into that picture?
Sure. I have been teaching in the DPT program at the University of Central Florida in Orlando since 2009. I think I pretty much first got interested in pain science. Specifically, I knew the moment. I was at the APTA's Next conference in the summer of 2016, and I heard Stephen George do a talk, the John H.P. Maley lecture, and he talked about the roadmap to a pain revolution, and that just really stuck with me. And I left that conference thinking, man, it's 2016. I've been a PT now since 1999. How have I never heard any of this before? So I really thought it was quite fascinating. And I needed to come back to my program and figure out how I could learn more about pain science and learn how I could be an educator in pain science.
Yeah. That was a great PT Next. I was there actually. I presented that one. It was a really fun PT Next. I'm sorry that they're going away.
Me too. I did have a couple posters that I was presenting there, and had never been to Next before. I typically go to CSM every year, but hadn't been there to the Next conference. So
we'll have to start the next, so to speak. I think smaller conferences. It wasn't a very small conference. It was about 2,000 to 3,000 people. But I think those smaller events, oftentimes, as you mentioned, introduce you to things that you may not normally hear in a way that's a little bit deeper, and then you get to connect with people in different ways. So how did you go from, so I think so often we go to conferences or we come across maybe a book or a paper that just kind of takes us on a little fork in the road, and you're down the pain science route, so to speak. What was your trajectory like as far as learning about it? And then what motivated you to really kind of put it into the program? How did that all play out?
That's a great question. I think when I got back from the conference, shortly thereafter, I found the Pain Reframed podcast, which I'm not sure when that officially began, but I know I started listening to that. I was already teaching the therapeutic modalities content in our curriculum, and one or two of the modules had focused on inflammation and tissue healing, and then of course pain, because that's the context that modalities are often used in PT practice. So my first inkling was, how can I expand what I'm teaching in this pain content? So it went from 1 week of content to 2 weeks of content, and then trying to insert it a little bit more into some of my other courses that I was teaching, like therapeutic exercise. So it was sort of a natural progression, but as I learned more, I thought, wow. And then as I found the International Association for the Study of Pain curricular objectives, I figured, wow, if I'm really going to be able to do anything with this, it's going to have to be a free standalone course. At least for our program, I didn't see a way to naturally fit it into the coursework that was existing.
Yeah, there's lots of different questions about that with regard to pain science. Should it be a standalone course? Should it be embedded in another course? Should it just be kind of seeded throughout the entire PT curricula? The DPT curricula now is quite lengthy, over 100 and something credits, depending on the school year, and sometimes upwards of 130. What were those conversations like with other staff at your university and the chairperson with regard to kind of that decision? Because there are some people out there who really do believe that, no, it should be this. These are concepts that should be embedded throughout the curriculum. And there are other people who are like, well, this is so specific and so unique to obviously what we're doing as far as physical therapists that we need a separate course.
Well, I think I got pretty lucky. I did have great support from my program chair. So that was a huge plus. And, it was probably summer of 2017 where I was really thinking, I think we need to get this moving. We are a public institution, so of course things do take a little bit longer to go through the processes. But I was at the time teaching 2 courses in therapeutic modalities. The first course was maybe more of the, mechanical, like thermal agent type of course. And then the second one was all electrotherapy. And I looked at the curriculum, I looked at the content, and I thought, I could probably merge all these modalities into one course and then have this room for all of this pain science stuff. And so my program director was completely on board. And, some of the guidelines for the NPTE exam had changed in terms of what type of content was being tested for modalities. And so that, in conjunction with having 2 courses, I said, it kind of doesn't make sense to spend time teaching some of these modalities that aren't even being tested now on the NPTE. So maybe we should go ahead and move forward and kind of get in line with these, which were coming out to 2018 objectives from the IASP. So it was a nice conversation that just kind of kept growing and kept getting more support. And I think everybody in all my faculty were very supportive. And like I said, my program chair was huge, because he said, well, we're going to figure out how we can change this second modalities course and make it a pain science course.
So out with the old and in with the new, so to speak.
Absolutely.
I must say too, I can't remember how many credit my modality course was in PT school. I feel like it was maybe 3, but 2 at a program, it seems like a lot to me, but I know every program is a little bit different.
Yeah, I think the total was 5 credits. It was 3 maybe for the first part, and then 2 for just the electrotherapy. So I still do teach a 2-credit therapeutic modalities course, and then a 2-credit now pain science course.
Right. So the pain science course is 2 credits.
It is.
It's a semester long, it sounds like.
It is. It's taught during the summer. So it's a truncated semester where it's 12 weeks as opposed to the traditional 16 weeks. That would be typical of a fall or spring semester. So we actually end up meeting for 3 hours a week because of that truncated time.
That's good. Yeah. And then so there's a bit of a distinction between pain science and pain neuroscience education. Some overlaps, but some distinctions too. Can you tell us about the distinctions between them, and then how you approach that within the context of the course you've created?
Absolutely. The course is actually called Pain Mechanisms and Treatment and Rehabilitation. So it definitely is a comprehensive look at pain from the basics of the pain neurobiology, and then into how do you best assess pain, and inclusion of a lot of the outcome measures that have become popular. And then we go into talking about those individual differences and pain variability that you see in different patients and different populations. We talk about the mechanism-based approach to to pain management for the PT. And then we do spend quite a bit of time talking about therapeutic alliance and talking about motivational interviewing. We do some role play with those 2 topics. And we do talk about pain neuroscience education as an intervention or as an educational intervention. And I explain pain type of modeling, again, as a mechanism for educational intervention. And then we get a neat time, and then we actually get to review some of the key concepts of the modalities course, which was taught the semester prior. We talk about some of the other, interdisciplinary topics that are related to pain, some things that you've highlighted on your show, like sleep hygiene and nutrition and lifestyle factors. And then we talk about some of the psychological approaches that are used in pain management as well. So again, some of the things you've covered extensively on your podcast with regards to, cognitive behavioral therapy and ACT, and just even basic, relaxation, breathing, mindfulness-based stress reduction. So they get all of this kind of in the beginning, and then the very last 2 weeks, then we talk about all those concepts in the context of some of the common pain syndromes, if you will, like fibromyalgia or chronic headaches or chronic low back pain, even moving into like chronic regional pain syndrome and osteoarthritis, rheumatoid arthritis, those kind of things. So it's definitely more, to get back to your question, definitely quite a bit more than pain neuroscience education, which really encompasses just about 1 module of the 10 modules that we have.
That's really interesting, because you really have a lot packed into. It's 12 weeks, 3 hours, so it's about 36 hours, so to speak. And you're covering a lot of different topics, which I think is great. And when I've looked at a lot of the research around pain education and cognitive behavioral techniques, like what does it take to train a practitioner in that? And the really kind of like bottom barrel limit is a weekend course, which is probably about 14 hours.
Okay.
But your course is going to 36. So you have some room to pack in other topics, which I think is great. Is there anything, I'm just curious, I'm trying to think back to when I was a young sprite PT, which was quite a while ago. But is there anything that the therapists are, and this is their last kind of summer before being seniors?
Actually, it's right in the middle. It's the beginning of their second year. So we have a 9-semester program. And so this actually falls during the 4th. Is that right? No, that can't be right. Yeah, 4th semester of the program.
So it's pretty early.
And it's right before they go on their first clinical internship.
Well, that's great, though.
And I will tell you, I mean, we always, as educators, are tasked with, how do you measure student learning? But I will say that our director of clinical education states that a good majority of these students go on to do their clinical in-service on something to do with pain science and something with pain neuroscience education, whether it's a 10-minute talk on sleep hygiene, and they're doing this to all the staff at the hospital or all the staff in an outpatient clinic. So that to me is very exciting, because I do feel like we have to kind of be the army to get the information out there. And so that might be just a room full of PTs and OTs, or it might be a room full of physicians and physician assistants and nurses. So it's, I think, really exciting.
Yeah. Is there anything you find that they kind of really latch on to? Like, people really become interested in, I don't know how deep you're going into things like CBT or mindfulness or ACT or pain neuroscience education, anything specific that people like, where I really want to know more about X, so to speak?
Sure. I do think they definitely latch on to that concept of therapeutic alliance and the motivational interviewing. So I think they really want to get better at that piece so that they can make that connection with the patient, so that then they can make suggestions with regards to some of the psychosocial behavioral techniques that might be available. It's real interesting. Part of my coursework entails, of course, using a great textbook by Kathleen Sluka. And also, we also will listen to podcasts, and my students have really, really enjoyed podcasts. And so we'll have them listen to the Healing Pain podcast, or maybe the Pain Reframe podcast, and write reflection papers on the topic. And so it's been really interesting to read people's topics. And I think there's a lot of students that have a tendency to really enjoy the mindfulness-based stress reduction, some of those techniques that maybe they've been exposed to before. And so I would say they're, I think, really fascinated by a lot of it. I know when I was doing the lecture on graded motor imagery, they just thought that was completely fascinating, because they've maybe seen some of it, but it was limited to maybe rehabilitation status post-stroke versus somebody that just has maybe a chronic regional pain syndrome of the extremity. So
I know many academics are interested in qualitative research. I'm just wondering if anyone in the program has attempted to analyze any qualitative or even quantitative research with regard to the students coming through your course. I mean, of course, you're looking at their grades, so you know they're passing or not, but just some of the more qualitative, you know, what they found valuable, what they would like to hear more about. Should this be a two-part course like modalities was maybe? You know, because some of these topics you can spend a lot of time on.
Absolutely. I would say this is something that I would aspire to do. You know, the first time I delivered the course was summer of 2019. And I was just trying to get myself organized and figure out what I was doing. I know I was working week to week trying to produce something good. And then the summer of 2020, instead of being able to deliver it face to face, I had to deliver online. So I kind of had a little derailment as far as my ability to do some research. But that isn't my plan for the summer of 2021, is to collect some pre-data and maybe some post-data, some of the research looking at just these effects or knowledge and attitudes about pain, using the HC pairs as an outcome measure, or using the neurophysiology of pain questionnaire, just to kind of do some baseline pre and post. The neat thing that this is kind of expanded onto is that our program is very involved in interprofessional education events with our College of Medicine and our College of Nursing, as well as pharmacy and some of our social work and counselor education programs. And so I've been able to kind of take this to one of our interprofessional events, and the team of students work together to evaluate a patient who has chronic low back pain, and it's a simulated patient. It's a paid actor, and they get a 30-minute presentation from me just on pain science and the factors of things to think about when you do your exam. And they get to go in as a team and interview this patient, who is a simulated patient that's working from a script that I was able to write. I kind of wrote the patient case. So that's been really neat to see the differences with the other professions and how well versed they are in this area, in this topic.
That's really great, because I'm actually working with a group of licensed professional counselors right now, mental health counselors, and they have wonderful counseling skills, but they really receive nothing with regard to pain science in their curricula. They're master's trained professionals, but that's pretty consistent throughout all of the mental health professionals. I mean, PTs really are at this point leading the pack as far as having pain science in the curricula. But it is interesting. I think the interprofessional and collaborative opportunity that's there for us as professionals to train other professionals in what we know. And through that, not only does it help them be better professionals and practitioners, but it also helps them understand what we really do.
Absolutely. And that is one area that we've had. I was able to get some pre and post data collection on that we're in the process of analyzing and kind of stratifying based on health profession in terms of, pre-existing beliefs about pain. And then, did it change during the intervention? Not the intervention, but the lecture component, as well as the interaction with the simulated patient. So we were in a really neat position to kind of look at those things. And we have to consider, the year that the students are in their respective programs as well, to see where they get it. But as far as I know, we are definitely, like you said, kind of leading the pack, at least at our institution, in terms of the amount of pain education that our students receive.
And the course you have really sounds like almost like an integrated pain course in a certain way. Are there questions that come up, for example, if you're discussing healthy eating and nutrition, are there questions that come up like, is this in my scope of practice? Can I work nutrition in during my clinical affiliation? When do I know that I'm quote unquote, and this is the question I get asked all the time, when do I know I'm not being a psychologist if I'm using ACT? Which is kind of a funny question. We never are holding ourselves out to be psychologists. We're using principles of care to help inform our practice. But how do you approach those topics with regard to the students? And I also imagine some of the faculty who, when you probably brought this in, weren't quite sure how this fits into the curricula either.
Those are great questions. I think, we kind of always go back to our APTA sort of as our governing body and our professional guidance for what's within our scope. And then I often will reference, at least for the state of Florida, what's within our Practice Act for the state, and how those things are covered and how they are classified, and if there is any, vagueness to it. We also have a general health professionals practice act that we can follow as well. So some of these things are covered under that, and we're allowed to do these things. Now, I always tell my students that you can do what you feel comfortable doing. And once you don't feel comfortable doing it and you've kind of gone outside your level of comfort, then that is definitely time to refer for sure.
Right. So helping them identify their personal scope as they go out into the world. You have read some of the Florida Scope of Practice Acts. I have yet to really see a PT Scope of Practice, or PT Practice Act, I should say, that limits us with regard to really anything that we have talked about on this podcast, like not nutrition, not psychosocial aspects, of course, not exercise, et cetera, et cetera. Do you find that to be the case?
I do. And I think a lot of times when you just see a blanket statement that might be health and wellness, or anything that's, designed for management of pain, all of these things fall under that umbrella. Right. The nice thing is my program director actually sits on the board of PT practice for the state of Florida. So I know he had all of those things cross-checked before, we kind of embarked on the process to get it approved for the university. So
that's great.
So it's been a really neat experience.
Yeah, because whenever I give a lecture on nutrition or ACT, that's always the first thing. I used to put it to the end of the lecture, and now I just put it front and center because there's so many questions around it. But I think what you're saying is our practice acts include health and wellness promotion, all of them.
All of them.
And this falls under it. So we don't, and I really kind of am repeating this for our listeners who are PTs, you don't have to have your practice act spell out a Mediterranean diet or mindfulness, so to speak. That these are skills that if you didn't maybe touch on them in school, like you're doing so eloquently with your students, they're skills you can develop outside of the classroom, so to speak.
Absolutely. And educating yourself and taking continuing education courses and pursuing extra certifications, if that is an avenue that you really feel like you need more skill set in and that you want to be better at in terms of being able to deliver that type of intervention for your patient. Absolutely.
That's right. So you don't have to use nutrition, for example.
Correct.
You don't have to use mindfulness, But if you choose that's something that you want to implement, you can go for further training on that and use it.
Absolutely.
Yeah.
Absolutely.
How would you like to see your course develop as you go through into like beyond your third cohort, which is coming up? Like if you had carte blanche and you can do anything with it, what would you do as far as credit hours, as far as techniques and methods within the course?
Great question. I think I'd like to bring in possibly some more guest speakers that are really knowledgeable on some of the information that I don't have a strong skill set in. I would love to bring somebody in that's an expert and can teach mindfulness-based stress reduction, or to teach CBT, or to teach ACT. I think that would be a really neat addition. I'd like to do some more role playing with, it's one thing to have students play roles with other students, but I always have my students think about, they know somebody that has persistent pain. So play that role, whether it's your grandmother, your neighbor, your aunt, just play that person for your classmate to evaluate. That usually works, but I think it's been a really neat experience to have like a simulated patient as well, to really work on those soft skills with the interviewing piece and the motivational interviewing and the therapeutic alliance. And then, yeah, I would love to have some more experience for the students in some more situations where they can actually articulate the pain neuroscience education piece. I think that is a skill set that you kind of have to rehearse to some degree. It doesn't come easy to a lot of people.
Yeah, that's very true. Have you had input or anyone reaching out from other universities saying, hey, I heard you created a pain science course. What does it look like?
I haven't. And, I was interviewed with our university newspaper late last year about this course. And I looked to see how many universities in Florida anyway have a standalone pain education course to that matter. And I honestly couldn't find something with any of the curriculums that were available to the public. That doesn't mean they don't exist, but I do feel excited that I was able to get this underway, and I would, love to help others kind of start something like this. And I do like the standalone model. I know that doesn't work with every curriculum. I just found myself in a really nice position to kind of, like you said, out with the old and with the new on this particular course. But yeah, I would love to do some more collaboration in terms of launching courses, and also just figuring out how we can best, like you said earlier, get that quantitative review of how the students are doing in this type of coursework.
Yeah, I've done some poking around in the state of New York. We have a lot of PT programs here. And I've done some surveys actually of the curricula, talking to both the directors as well as looking at the websites. And it doesn't, I have to say, what you've done is pretty unique. It doesn't really stand out. As you said, you can go on to a university website and try to look at a curricula.
Sure.
Hopefully it's updated, but they don't stand out the way you have created it. Do you think that's a function of CAPTI? Should CAPTI be more specific and provide a little bit more direction? Or do you think it's just, there's just naturally some flexibility and fluidity in a program, and it just depends on the program itself?
Yeah, I mean, I do think it's something that CAPTI probably will be addressing. Accreditation is good for 10 years, so that's a huge gap. I know I was our program when we went through CAPTI certification 2013, but we're not due until 2023, so it's coming. But since the APTA in 2018 did endorse those, International Association for Study of Pain curriculum outlines for DBT education, I would think that it's probably coming to that point. Ironically, CSM tonight is got a live presentation on looking at implementing recommended core competencies into physical therapy education, specifically for pain education. So there's a nice panel of people that will be speaking at CSM tonight. So I'm looking forward to that. But I feel like there is going to be some interesting discussion on standalone course versus integration through the curriculum, and what may work for one university may not work for another. And that's totally fine. But I'm glad I could share how it's worked for our institution anyway in Orlando.
Yeah, it's interesting on some levels. I almost feel like what's happening in continuing education and what's happening in the clinic is outpassing what's happening in the curricula at times. Not yours, because your course is very forward thinking, but I would imagine in some schools, and I know this because I train therapists myself, they're saying, I didn't receive a hint of any of this.
Well, and that's like I said, I hope that my students are the army that goes out there and shares this level of knowledge. There was an article in JOSPT that was, the lead author was Adrian Lowe. I know you've had him on your show recently, talking about not just the need to educate the student, but the need to educate the clinician.
Yeah.
And so, hopefully this is, if we educate our students, they go into clinicals and they can educate maybe their clinical instructors who maybe have been out of education for a while, at least to give them a little snippet of it. And maybe that's the spark that gets them to go take a continuing education course or go learn more about it. That's my hope.
Yeah, mine too. I mean, I definitely think we have a large profession now. We've grown in number of PT schools, and with that the number of professionals that are practicing. And I think there's probably a whole section of people that are invested in their professional development. And then there are people who are just doing the bare minimum.
Yes.
And they're really just saying, I'm just going to take a 2-hour continuing education course. And they probably, are sitting there with a beer in their hand as the video's playing. But I really think for us to maintain being primary care providers of pain, both acute as well as chronic, courses like this are needed, both inside the curricula as well as outside. So I appreciate you putting that together. Carey, it's been great chatting with you. Tell us how people can learn more about you and what you have planned for the future.
Oh, well, great. Well, I'm not big on social media, but you can find me at the University of Central Florida. Just type me in as a faculty. My email address is carey.rothschild@ucf.edu. That's probably the best way to get in touch with me. I do have some plans to hopefully get some research out there with regards to the study that we did, collecting some pre and post data on our interprofessional event. I also have some students that are looking at kind of doing just a summary of pain neuroscience education, different methods of delivery, whether it's better online or in person, and especially with the world of telehealth, trying to look at how we can maybe implement some of these things in a virtual format.
That's great. So as Carey mentioned, you can reach her at the University of Central Florida. Her email, which is carey.rothschild@ucf.edu. Of course, that link will be on the show notes at the Integrative Pain Science Institute. You can Google her at the university there, or you can find her on our webpage. Carey mentioned she's not big on social media, but she will be big once you all share this information with your friends and family. Make sure to share this with your friends and family on Facebook, LinkedIn, Twitter, or a Facebook group where people are talking about pain science and pain neuroscience education or other types of interventions with regard to the safe and effective treatment of chronic pain. I want to thank Carey for joining us this week. I'm Dr. Joe Tatta, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.